Yeah.
Welcome back to the third phase of exercises to fix your back pain and to strengthen your back. And if you're here, it means you've been through 2 phases of exercise already, each lasting for a month. And through these exercises, I hope you're feeling better and feeling stronger. And take a moment to congratulate yourself for the dedication you've shown, and surely the fruits of your labor are awaiting you. Now, a big shout out before we start this phase to our model Neeraj Vaswani, and he's a celebrity fitness coach also. I've left his link down for anyone who wants to check it out. So we'll get straight to the exercises. This third phase is in 2 parts. One is the warm-up part, and the second part is the new exercises. There are 3 warm-up exercises as always, and the new exercises will be slightly more challenging than what they've been before. So the first exercise is a straight leg raise. So you've already been doing this, so you should be very comfortable with it by now. Take your time, do 5 repetitions each leg and do 10 sets of that. Keep your core tight, breathe normally throughout the exercises. While a little bit of pain is good, if it hurts too much, then it's worthwhile to stop and take a break. So you do this about 50 times, 50 repetitions in total. So this is a core strengthening exercise. The second warm-up exercise is our mobility exercise, where you lie down on your back and with your feet at shoulder width apart, you drop your knees from side to side. So this should be done at least 50 to 100 repetitions. Again, you keep your body nice and relaxed. This is a hip mobility and spine mobility exercise, and you rotate from side to side. After about 50 to 100 repetitions of this, you can move on to the second variation, which is putting your feet close together and doing the same thing. So here you can see Neeraj's feet are close together and he's doing the same thing. Keep your body relaxed, breathe normally, and you do this for 50 to 100 times. Now in phase 1, I had asked you to combine these exercises with 45 minutes of walking daily, slow walking. In phase 2, I had asked you to combine this with 45 minutes of brisk walking. And now you're in your 3rd month. You may choose to increase it a little bit. You can start slow jogging for 45 minutes daily along with these exercises. The 3rd warm-up exercise is the pelvic bridges. Again, you are aiming to do this 50 times. And with your foot planted down and your shoulders planted down on the mat, you lift your pelvis up till it's in a straight line with the body. As soon as you straighten your body out, hold it for 3 to 5 seconds before you let go. Breathe normally throughout the exercise. So this will complete the warm-up and sets the stage for the next 3 exercises, which are the new exercises in this phase. These exercises are to be done daily. So the first new exercise of this phase is a spot lunge. So a spot lunge is when you're standing straight and you lunge down in front. Make sure your knees don't go ahead of your feet. And you lunge down and you'll feel a stretch in the hamstrings and the glutes. This should be very comfortable. You can rock yourself front and back a few times. Breathe normally. You don't have to lunge all the way down. If it's difficult, then you can do a partial lunge. And if it's easy, you can go all the way down. So do this about 25 repetitions on each leg. Breathe normally throughout the exercise. So lunges are a great way to increase the strength in your lower body and the back, and to bring a good balance around the back and the hips and the legs. So in the second phase of the lunge, once you've done the lunge, you can cross over your foot to the other side like Neeraj is doing in this video, and stretch the hamstrings a little bit more and the buttock a little bit more out. So once you're in this stretch, hold it for 15 to 30 seconds, and then you come back and do the same stretch on the other side. So you can do this stretch 2 to 3 times. If it's painful, if you're not comfortable with it, then you may avoid doing it. It's not necessary that you have to do it. As always, get cleared from your doctor to do these exercises. Don't rush through it, take your time, get comfortable with each exercise before moving on to the next. The second new exercise is a plank. So this is a partial plank where you're on your knees and your elbow. The normal full plank is when you hold your body like a plank or a log of wood between your toes and your elbow. So you can, if this is very difficult, you can start with a partial plank. Hold it for 30 seconds to 1 minute if you can. Start small and work your way up. And do the plank for 30 seconds each time, maybe 5 sets. Don't overdo it. Start slowly and work your way up. I keep saying this because this is very important so that you don't injure yourself. And the last new exercise are Supermans. Try to hold yourself up for as long as you can. Breathe normally throughout the exercise. You do this for about 30 to 50 repetitions, and you'll feel a good contraction in your lower back and the buttocks. And in the second phase of this exercise, you put your hands by your side and you stretch yourself up, all the way up, and you feel a good stretch in your abdomen. So you hold this stretch again for 15 to 30 seconds and then slowly let yourself down. And that's just one rep. You do this for 30 to 50 reps. If you feel too tired in between, you can take a break. So that concludes our phase 3. I hope you're on the path to recovery and you're feeling much better. Our last phase is phase 4, which will be coming up after this, and that will last for another 3 months. So totally you will have done 6 months of these exercises. After 6 months of these exercises, you're good to join a gym. You're good to carry on any exercise that you want to do, or your fitness goals or your fitness ambitions. You can go and pursue them, but do get clear from your spine specialist. I hope you like such content. If you do like it, leave us a like and do subscribe. Thank you.
Yeah.